What if the breakfast you have been eating every single morning, the one your doctor said was the smart choice, is actually the reason your blood sugar refuses to come down? And what if the fix is not a new medication, not a complicated diet, but one simple change you could make tomorrow using something already in your refrigerator right now? Stay with me for the next few minutes, because what I'm about to share has helped real people, people just like you, finally start seeing their numbers move in the right direction after years of frustration. We are talking about eggs. And before you assume you already know everything about eggs and diabetes, I need you to hear this. There is a very specific truth most people are never told. And that missing truth could be the exact reason your blood sugar has stayed stubbornly high no matter how carefully you eat. The answer has been sitting in your fridge this whole time. You just did not know how to use it. My name is Dr. Gregory Allen. I've spent years working with patients who have type 2 diabetes, people who are doing their best, following the rules, and still not getting the results they deserve. What I share on this channel is based on current science, not advice from 30 years ago that nobody updated. No false promises, no miracle cures, just honest, practical information you can actually use. If you want tips like this every week, subscribe right now and turn on the notification bell so you never miss a new video. And please stay until the end of this one. The practical section coming up is where everything clicks into place. That is the part that changes things for people. Do not skip it. Before we talk about eggs specifically, I need to walk you through something that makes everything else make sense. Because if you skip this part, the rest will not land the way it should. When you have type 2 diabetes, your body has a harder time handling carbohydrates than it used to. You probably already know that, but here is what most people are never clearly told. Not all foods hit your blood sugar the same way. Some foods not only avoid raising your blood sugar on their own, but they can actually reduce how much other foods raise it when you eat them together. That is a real thing, and it changes how you should be thinking about every meal. Protein is one of those foods. When you eat good quality protein alongside carbohydrates, something important happens inside your body. The protein slows down the rate at which sugar from those carbs enters your bloodstream. Think of it like a speed bump on the highway to your blood. Instead of everything rushing in at once and sending your glucose shooting up to 200 within the hour, you get a slower, more gradual rise that your body can actually manage. Less stress on your pancreas, more stable energy, better numbers. Now here's where eggs come in. Eggs are one of the most complete and available sources of protein you can find. 2 whole eggs give you around 12 grams of high-quality protein that contains every essential amino acid your body needs but cannot make on its own. That matters a lot. And here is something most people do not know. The glycemic index of eggs is 0, completely 0. Eggs on their own do not raise your blood sugar even one single point. But when you pair them correctly with other foods, they create that protective effect I just described, reducing the blood sugar impact of everything else on your plate. That is not a small thing. That is a game changer. Now I have to address something directly, because it is the #1 reason people with diabetes avoid eggs, and it is costing them. For decades, Americans were taught that the cholesterol you eat goes straight into your arteries. Eat eggs, raise your cholesterol, hurt your heart. That message was everywhere. Doctors repeated it. Health magazines printed it. And a lot of people believed it so completely that they stopped eating eggs entirely and never looked back. Here is what current science actually shows. For most people, the cholesterol you consume in food is not the main driver of the cholesterol levels in your blood. Your liver produces cholesterol on its own, and it adjusts that production based on many different factors. What actually tends to push those numbers in the wrong direction is not eggs. It is refined sugars and trans fats. In fact, research published in respected medical journals has found that eating whole eggs can actually improve your cholesterol picture. Specifically, it can help raise HDL, which is the good cholesterol that protects your heart. And it can shift LDL particles from a smaller, denser form, which is more problematic, toward a larger form that carries far less risk. But here is the part that is almost painful to think about. Many people with diabetes spent years avoiding eggs and replacing them with oatmeal, cereal, toast, and orange juice, foods they believed were safer. But those replacements are loaded with fast carbohydrates and contain almost no protein to slow them down. So their blood sugar kept climbing, and for some of them, their cholesterol numbers did not even improve. They gave up the one food that could have helped them. I want to tell you about a patient of mine named Danielle. She came to my office about 10 months ago, and her story has stayed with me ever since. Danielle was 64 years old. She had been managing type 2 diabetes for 8 years. When she walked into the room, she was holding a thick folder of lab results, printed out and organized, the way someone does when they have been fighting a long battle and want to show you the proof. She sat down, and before I could say a word, she started to cry. Not dramatic crying, the quiet kind. The kind that comes from someone who has been doing everything right for years and still cannot understand why nothing is changing. She told me she had stopped eating eggs almost 2 years earlier because her previous doctor had warned her about cholesterol. She had switched her breakfast entirely. Every morning she was eating instant oatmeal with honey, a ripe banana, and a glass of fresh orange juice, because she had been told that was the healthy option. She walked 3 times a week. She never missed her medication, and her fasting blood sugar was still running between 155 and 175 every morning. Her A1C was 8.2%. Her cholesterol had actually gone up. When she described that breakfast in detail, I understood the whole picture immediately. Instant oatmeal, honey, a ripe banana, orange juice. That combination, as healthy as it sounds, is a large amount of fast-absorbing carbohydrates hitting the bloodstream all at once, with almost no protein present to slow any of it down. Her glucose was almost certainly climbing past 210 within 30 minutes of eating. And because there was no protein to keep her full, she was hungry again by mid-morning, snacking, and her blood sugar was riding up and down like a roller coaster all day long. Her pancreas never got a moment of calm. I walked her through the updated science on eggs and cholesterol. Then I suggested one single change. Just one. Build breakfast around real protein instead. 2 weeks later, she called the office sounding like a different person. "Dr. Ben," she said, "my blood sugar after breakfast is 140, not 210. I checked 3 days in a row because I could not believe it." After 1 month, her fasting glucose had dropped from 165 to 142. After 3 months, her A1C moved from 8.2% down to 7.5%. Her LDL also improved. At her last appointment, she told me, "I used to dread breakfast because I knew how bad I would feel 2 hours later. Now I actually look forward to it." Now here is the part you have been waiting for. Let me walk you through exactly what to do so you can start experiencing this yourself. First, how many eggs are actually safe? For most people with type 2 diabetes who do not have serious kidney disease or other specific conditions, 2 to 3 whole eggs per day is not only safe, it is genuinely beneficial. I want to be clear about that because many people are still eating 1 egg every few days as if it is something dangerous. It is not. Whole eggs, not just the whites. The yolk is where most of the real value lives. It contains choline, which your liver needs to process fat efficiently, and that matters a great deal when you have diabetes. It contains vitamin D, which studies have linked to better insulin sensitivity, meaning your cells respond more readily to the insulin your body produces. It contains lutein and zeaxanthin, 2 compounds that protect your eyes from the kind of damage that high blood sugar causes over time. And it contains B vitamins that support your nervous system and help prevent the tingling in the hands and feet that many people with diabetes start to notice as the years go by. The benefit is inside the yolk. Do not throw it away. Now, here is where most people go wrong. And this is the part that makes all the difference. It is not just whether you eat eggs, it is how you prepare them. Frying eggs in a generous amount of butter or oil and pairing them with white toast or flour tortillas creates a combination of saturated fat and fast carbohydrates that temporarily blocks your insulin response while spiking your glucose. At the same time, not because of the egg itself, but because of everything surrounding it. The right method is much simpler. Scrambled eggs in a nonstick pan with no oil at all are perfect. Eggs contain enough of their own natural fat that they will not stick. Just beat them, pour them in over medium heat, and stir gently for 2 to 3 minutes until just set. Boiling is even easier for busy mornings. Cold water, bring to a boil. 10 minutes for a firm yolk or 6 if you prefer softer. Boil a batch the night before and keep them in the refrigerator with zero morning effort. A vegetable omelet in a dry nonstick pan is another excellent option. What you pair with your eggs matters just as much as how you cook them. Avocado is the ideal partner. Its healthy fat slows digestion and stabilizes your blood sugar without adding any carbohydrates. Spinach provides magnesium, which many people with diabetes are chronically low in, and that mineral plays a direct role in how well your cells respond to insulin. Tomatoes, peppers, and mushrooms all add fiber and volume with very few carbs. If you want to add a slice of real whole grain bread with visible seeds and a dense texture, eat it after the eggs, not before. Starting with bread spikes your glucose before the protein can do anything. Starting with eggs means the protein is already working as a buffer by the time the carbs from the bread arrive. Same foods, different order, meaningfully different blood sugar result. One more thing that surprises most of my patients: eggs are not just for breakfast. When you eat quality protein at dinner instead of starchy carbohydrates like rice or bread, your liver manages overnight glucose release in a calmer, more controlled way. For some people, this can mean a fasting blood sugar 15 to 20 points lower the next morning. Not because of a new pill, because of 2 eggs with vegetables for dinner. Let me tell you about James, because his story illustrates something important about how these changes work in the real world. James came to see me about 7 months ago. He was 58 years old, a quiet man who placed his lab work on the desk without saying a word and looked at me waiting. His A1C was 8.6%. His average fasting blood sugar was 178. He had been living with type 2 diabetes for 5 years and had been on metformin for 3 of them. When I asked about breakfast, he described it simply: 2 eggs, refried beans, and 3 corn tortillas every morning. He thought it was a reasonable meal because it included eggs and beans, both sources of protein. He could not understand why his numbers were not better. Here is what was happening. The eggs were being fried in oil, the beans had been refried in fat, and 3 corn tortillas added a heavy carbohydrate load on top of all that. That combination of saturated fat and refined carbs was blocking his insulin response while pushing his glucose up every single morning before the day had even started. I suggested a minimal and specific change: scrambled or boiled eggs with no oil, whole beans with much less fat instead of refried. Drop from 3 tortillas to 1 and add fresh vegetables to fill the plate. That was it, nothing else. 3 weeks later, James came back. For the first time since I had known him, he had a small smile. He said, "My morning numbers are 145 to 155 now. They never used to go below 170. I did not change anything else." After 4 months, his A1C had dropped to 7.8%. His primary care doctor asked what he had done differently. James answered the way James always did: concise and honest. He said, "I changed how I make my eggs. That was all. I want to give you something concrete you can act on starting tomorrow without having to figure anything out or memorize a complicated plan." For breakfast, the target is 2 eggs scrambled in a dry nonstick pan, or 2 boiled eggs prepared the night before, paired with half a ripe avocado and a generous amount of vegetables like spinach, tomatoes, or peppers. If you need more volume, 1 small slice of real whole grain bread with visible seeds is fine. Just eat the eggs first. For a mid-morning snack, if you find yourself getting hungry before lunch, a hard-boiled egg alongside a small handful of almonds or walnuts is a combination that barely affects your blood sugar at all and keeps cravings quiet for hours. No cooking required if you prepared the eggs in advance. For dinner, when you want to take advantage of that overnight fasting blood sugar benefit, a 2-egg omelet loaded with whatever vegetables you have on hand is a light, satisfying, and surprisingly powerful option. No bread with it, just the eggs and vegetables. What to avoid pairing with any of these meals is fresh orange juice, even the kind you squeeze yourself. For someone managing blood sugar, juice is essentially liquid sugar without fiber. A whole orange with its fiber intact is a much better option on the rare occasion you want fruit with your eggs. Before you make any changes, there are a few things I need you to know. If you take metformin, eggs do not interfere with that medication in any way. Include them with full confidence. If you take insulin, pay attention here. Shifting to a higher protein breakfast can make your insulin work more efficiently. Your blood sugar may drop more than expected. That is not a bad thing, but your doctor needs to know so they can adjust your dosage if needed. Have that conversation before you make the change, not after. On egg quality, organic pasture-raised eggs do contain somewhat higher levels of omega-3 fatty acids and vitamin D compared to conventional eggs. If they fit your budget and are easy to find, they are a worthwhile upgrade. But regular supermarket eggs are still extraordinarily nutritious. Do not stop eating eggs simply because organic is not available to you. The benefit is there regardless. I want you to leave this video with one thing completely clear. Eggs were never your enemy. What may have been working against you, without you even knowing it, was the way you were preparing them and what you were pairing them with. Change that, and you hand your body a real, practical tool that no single medication can fully replicate on its own. Danielle said it best. She told me, "I spent years thinking this was a battle I could not win. And it turns out part of the answer was in my refrigerator the whole time." That is exactly what I want for you. Subscribe right now for more information like this every week. Practical, science-based, no false promises. Give this a like, share it with someone who needs to hear it, and leave a comment telling me the one change you are making to your eggs starting tomorrow morning. This video is for educational purposes only. Always talk to your doctor before changing your diet or medication routine. See you in the next one.